Dwarfism is the condition characterized by short stature and short limbs. The most common cause is panhypopituitarism, where there is deficiency of growth hormone as well as other hormones. Such dwarfs, they cannot attain puberty and they cannot reproduce because there is deficiency of sex hormones as well. In few of the dwarfs, there will be deficiency of only growth hormone. Such dwarfs, they can attain puberty and they can reproduce. The body parts develop in proportion to one another, but the rate of development is delayed. So they will have short limbs and short stature. Treatment is with human growth hormone. It is given exogenously. So hypersecretion of growth hormone results in increased secretion of growth hormone, and two outcomes can happen. If the condition happens before adolescence, that is before the fusion of shaft of the bone with epiphysis, the person can become a giant. That is, that person can grow up to 8 feet tall. If the hypersecretion occurs after adolescence, the condition that develops is known as acromegaly. Let's see some acromegalic features. There will be frontal bossing, that is, there will be a large forehead with prominent supraorbital ridges. This is due to periosteal thickening of the membranous bones of the face. Then there will be prognathism, that is, the lower jaw will be protruded. Macroglossia means big tongue, and they will have coarse facial features. So apart from this, they will have diabetes mellitus because of the diabetogenic action of the growth hormone. Because of diabetes, they will have glycosuria, that is, excretion of glucose in the urine. They will have large spade-like hands, big feet, then they will have cardiomegaly, splenomegaly, hepatomegaly, etc. These are some features which I have just explained. Let's move on to next hormone secreted by the anterior pituitary gland, that is prolactin. It is a major hormone for lactogenesis. It is structurally homologous to growth hormone, and it plays an important role along with estrogen in breast development. It is tonically inhibited by dopamine and increased by thyrotropin secretion. And of course, just like any other hormones, it is regulated by negative feedback mechanism. So whenever there is a patient with underdevelopment of breast, we should think about prolactin deficiency. The main action of prolactin is to stimulate milk production and breast development. It also inhibits ovulation and release of gonadotropin releasing hormone. So again, patients with deficiency of prolactin can present with amenorrhea. And prolactin inhibits spermatogenesis in male. So prolactin excess can be caused by hypothalamic destruction or prolactinomas. So prolactinomas are prolactin secreting tumors. The signs and symptoms are galactorrhea, that is increased milk production, decreased libido, and amenorrhea. Treatment is usually with drug called bromocriptine, and of course the underlying cause has to be treated. Prolactin deficiency can be caused by destruction of anterior pituitary gland, and the main symptoms will be failure to lactate. Now let's see the hormone secreted by anterior pituitary in summary. We have the growth hormone, which is a single chain of 191 amino acids. The main role is to promote body growth and secretion of insulin-like growth factor 1. It stimulates lipolysis and it is said to have diabetogenic and ketogenic effect. Prolactin is a single chain of 198 amino acids and it stimulates milk secretion and production. Thyroid stimulating hormone, which is otherwise called as thyrotropin, is a glycoprotein of 2 subunits. It stimulates the production of thyroid hormones by the thyroid gland and it is responsible for maintaining the size of follicular cells of the gland. The follicular stimulating hormone and luteinizing hormone are glycoprotein having 2 subunits. They play a role in stimulating the development of ovarian follicles and ovulation and formation of corpus luteum in female. It also stimulates the production of estrogen and progesterone in females. It regulates spermatogenesis in the testis in the male and production of testosterone by the testis again in the male. Adrenocorticotropic hormone, otherwise called as corticotropin, is a single chain of 39 amino acids. ACTH stimulates production of glucocorticoids and androgens by the adrenal cortex. It maintains the size of zona fasciculata and zona reticularis of the adrenal cortex. So that's all about the hormones secreted by the anterior pituitary gland.